doctors should be legally allowed to assist terminally ill patients in committing suicide up to 10% from last year. Not many, but some of us know family members or friends who have cancers or diseases that they will never be able to recover from. She is kind of the reason I did this speech, because I read up on her. She was 29 years old, she was diagnosed with glioblastoma, which is cancer in her brain. They went in and did surgery, they had it all taken out. Well, she went back to the doctor 2 months later. It was back and worse than ever. They told her she would have about 6 months to live. And so they told her, you know, we'll do chemotherapy, radiation, but it would be her whole head. They would do radiation of like the whole head, not just in one spot. So by the end of it, she would have like singed hair, she would have first-degree burns on her head, so she would really have like no quality of life. And she said, I would not tell anyone else that he or she should choose death with dignity. My question is, who has the right to tell me that I don't deserve this choice? That I deserve to suffer for weeks or months in tremendous amounts of physical and emotional pain? Why should anyone have the right to make that choice for me? The problem with this subject is that there should be a law allowing terminally ill patients to die when and where they please, as long as it is under physician supervision and done under the right restrictions. It makes it so patients do not have to play the waiting game even with their families. Often this position is argued on the grounds that physician-assisted death may be a rational choice for a dying person who is choosing to escape unbearable suffering at the end of life. Competent people should have the right to choose the timing and manner of death. Suffering means more than pain. There are other physical, existential, social, and psychological burdens such as the loss of independence, loss of sense of self, and functional capacities that some patients feel jeopardized with their dignity. It is not always possible to relieve suffering. Thus, physician-assisted death may be a compassionate response to unremitting suffering. Religious and secular traditions upholding the sanctity of human life has historically prohibited suicide or assistance in dying. PAD is morally wrong because it is viewed as diminishing the sanctity of life. Vulnerable populations lacking access to quality care and support may be pushed into assisted death. Furthermore, assisted death may become a cost containment strategy. Burdened family members and healthcare providers may encourage loved ones to opt for assisted death, and the protections in legislation can never catch all instances of such correction or exploitation. The states and the laws, physicians' aid in dying is legal in Oregon, Vermont, Washington, and Montana, where it is voted on through legislation. Similar legislation has been introduced in 2013 and 14 in Connecticut, Hawaii, Kansas, Massachusetts, New Hampshire, New Jersey, and Pennsylvania. None of these states have yet to approve these bills. The laws in all three states, Oregon, Vermont, and Washington, have strict patient eligibility criteria, limiting access to competent legal residents over the state age of 18 with a terminal illness, which is defined as a life expectancy of 6 months or less, and it has to be confirmed by 2 different physicians. Since the law was passed in 1997, a total of 1,545 people have had prescriptions written under the DWDA, and 991 patients have died from ingesting the medications. From 98 through 2013, the number of prescriptions written annually increased at an average of 12.1%. However, during 2014 and 15, the number of prescriptions written increased by an average of 24.4%. During 2015, 125 ingested the medication and all died. In Vermont, a lawsuit says that the 2013 assisted suicide law has been interpreted in a way that if medical professionals are not willing to help patients in their lives, then they must refer them to a physician who will. There have actually been a very low increase in death in Vermont via physician-assisted death due to laws not staying in effect. The Washington Death with Dignity Act passed on November 4th, 2008 and went into effect on March 5th, 2009. This act allows terminally ill adults seeking to end their life to request lethal doses of medication from medical and osteopathic physicians. These terminally ill patients must be Washington residents who have less than 6 months to live. People with dementia are unable to qualify for the Death with Dignity Act because by the time they are eligible to receive a terminal diagnosis with a 6-month prognosis, they are no longer deemed mentally competent. There was a ruling in Montana for the law to be passed, but it was denied and rolled out. These laws have been around since the 50s, and even more so when Kevorkian was around and assisted with physician-assisted deaths. So going through the history and the different laws in each state and restrictions. When a patient has no desire to go on living and wants to die before their condition gets worse, they should be allowed to decide their life ends and why. And there's some sources.
So what happened to the other 603 people that got the prescription that didn't die from it?
They just didn't take it.
They didn't take it?
So pretty much if they took it, they passed away from it. And I read that they were like the girl, Brittany Maynard, she took, they gave her like a big handful of barbiturates. So that's what